Good afternoon, Dr. Oglaza. Thanks for joining your own communications team. It's great to have your time today. I was just hoping you might be able to update the community on what's been happening in our region, where our COVID-19 activity is at this moment, and what can we expect?
Good afternoon. As everyone is aware, as of March 21st, the remaining public health measures are lifted in this province, and that means that masking is no longer mandatory in most public settings. And with these changes happening on March 21st, it is important to be aware that COVID-19 is still present in the community. It's still present in the KFL region, and that there's still a risk of transmission or infection.
Okay, and I know in the past you've mentioned things like community indicators. Can you tell us what these indicators are and what they mean?
Yes, certainly. Currently in KFL region, we are monitoring a number of indicators that tell us more about the impact of COVID-19 in the community, but also the magnitude of transmission that happens in this region. So in KFL&A, our transmission indicators, such as the wastewater signal, the wastewater detection of COVID-19 virus, and percent positivity, so how many people out of 100 being tested are actually positive for COVID-19, they have been gradually rising. And they've been rising for the past 2 months or so. But what's important is that the indicators of severity of COVID-19 illness in the community, such as measures like hospitalization rates, number of people in hospital, severity of outbreaks, continue to remain low and have been decreasing. What's also important here is to see the timeline in which this has been happening. So when we, with our experience from the previous earlier stages of the pandemic, anytime we would have a period of increased COVID-19 transmission in a particular community, these were usually followed by 2-3 weeks later, we would see an increase in hospitalization rates. So today, when we look at our rates, when we look at our community indicators from the 2-3 weeks ago, we had elevated level of percent positivity. We're at 14%, and our wastewater signal was increasing. So we would therefore expect that the indicators of severity would be higher now, and they also would be increasing, but that's not the case.
Okay, that's great. So what does that say for our community? Is it a reassuring message, or is it due to different variants? Like, why do you see the severity not increasing and decoupling from the other indicators?
Yes, so to put that in perspective, we currently have 5 people in hospital due to COVID-19, and this is the level of hospitalization not seen in this community since November 2021. So it is really truly significant how severity of COVID-19 cases has declined to the point where our transmission trends and our severity indicators are going in completely opposite directions. And those who are in hospital, they're frequently there for a shorter stay. And as you mentioned, this is likely one of the explanation is that we have a lower severity of Omicron. But another important factor and very important explanation here is this is thanks to the high rates of vaccination in our community. And overall, this is very reassuring news for this region.
Today, public health measures are being lifted, and this could be a different journey for our community. Can you tell us how we can transition into this new sort of beginning again?
Well, thank you. What's important to emphasize to the community is that we in public health are confident that our community is ready to move toward living with COVID-19 and lifting some of these remaining emergency restrictions that were put in place previously. As we transition, it will be important to acknowledge that deciding which activities to participate in will involve individuals assessing their own level of risk of COVID-19, while also being mindful of the impact that it may have on others around them. We know that public health measures have had a significant impact on reducing spread and severe illness of COVID-19. And these measures included, first and foremost, getting vaccinated, including a booster dose. That's a really significant protective factor that we have in our community, with really high immunization rates across all different age groups, and we lead in the province. It's also important, and another important measure that was practiced during this pandemic and could continue moving forward is monitoring for symptoms and staying home when sick. And lastly, wearing a mask to protect those at a higher risk of severe outcomes or to reduce own risk of exposure, while no longer mandatory, is still part of the multi-layer approach that individuals can practice in this region.
If people choose to wear a mask, or businesses choose to enforce, say, proof of vaccination, what do you say to the community members and those business owners?
It's a very good point. And it's really important at this time that we respect each other during this time of transition, where people are maybe trying to get more comfortable with everything that's changing around them in terms of provincial legislative framework and how we begin to interact with one another in this region. So please be mindful that there are members of our community who remain at the higher risk of serious outcomes of COVID-19. And some people may choose to keep wearing masks in places that they're not required. Some businesses may also choose to continue to require proof of immunization and require masking. And truly, the lifting of the provincial emergency measure is a welcome relief for some. And for those who are at higher risk, it might be difficult, as they will need to continue to practice personal protective measures. So we need to gradually move forward and get back to activities that positively impact our health and well-being.
Thanks very much for your time today.
Thanks so much.